Hello everyone, my name is Nike and I have a guest with me here. I know you can see the guest already. I'm supposed to tell her to come inside and I'll show me the guest, but you are seeing the guest already. So can you please introduce yourself?
Hi everyone, welcome to my YouTube channel.
It's not your
It's
teacher
not
there.
my So let's be serious.
Yeah, it's serious.
Okay. My name is Adedolapo Gbadebo and I am a midwife. I'm a friend to Nike and she's also my colleague. She was my colleague.
She was, exactly.
She was my colleague. But we are friends, we are
Okay.
sisters,
Okay.
and I'm a midwife.
Okay. All right. So we have 8 questions here to ask you because it's International Midwives Week, and so that is why I invited a fine midwife for that matter. What is it that made you decide to become a midwife?
Okay. You know, the story behind that is very funny because I actually did not want to become a midwife. In fact, nursing was out of the question for me. I only wanted to become a doctor.
Wow.
But JAMB was not having it.
Damn.
So there was a story about how, but that was a very long story about how I was meant to go and register for another JAM. After my dad took me to the JAM center and I registered, and he found the newspaper and saw that there was an opening in a school called School of Midwifery Korea, and he was like, I should give it a shot. It's like nursing. And since I wanted to become a doctor, I was still be in the business of caring for
Medical
people.
profession.
And I doesn't want me to sit at home for too long. I'm like, okay, let's give it a try. Let's give it a try. We got to this school. By the time we entered the school and we saw the buildings, and I'm like, I want to come to a school like this. No, I want to go to university. I've been to Obafemi Awolowo University. I've been to UI. I've seen how everywhere is. I'm not going to come to a school that only has 3 blocks and the hostels. I didn't want to. But then I'm one person that likes challenges. I don't like things. It's not like I'm a babe. I'm supposed to like easy things, soft life. But I just like challenges. So by the time I had to write the exam, I didn't prepare for it. I went for the entrance exam and it was tough. I'm like, wow, tough, terrific. The cutoff mark was 54 that year. That means that people had high scores. Because after I got to the school, I was seeing cutoff mark of 36, but during my own time was 54, and then I had the exact 54. I'm like, no, this is challenging. Then I was like, okay, let me give it a try. Then I like women. I've always been interested in how my body works, from ovulation to period. I started my period quite early, so I've always been curious about these things. So when I learned that I could learn all these things being a midwife, then I'm like, okay, let me give it a try. But then the school was amazing, having to see women in labor, able to help them. Like they're not totally helpless, but these people are in pain. They just want you to do something for them. It was a very, I can't lie to you, it was a very intriguing part that I was able to help people, even if it is the slightest thing, like rubbing their backs, that I could do for them. It was one of the things that made it more interesting for me. And then I was like, I'm all in, fully in. This is what I want to do.
What current midwifery qualification do you have?
Okay, I'm a registered midwife, basic midwifery. That's all I did. I did midwifery 3 years course, and that's what I still have. I would have gone for more, but then our country is very easy.
Exactly. So, how is the practice like in Nigeria?
Okay, midwifery in Nigeria is the sad part is that they have not made it a specialty yet. I've noticed that they've not made midwifery a specialty. Just believe that, okay, as if you're a basic nurse, you should get midwifery certificate as well. Like, you believe that because you're a nurse, you must be a midwife. Meanwhile, midwifery is a specialty. They've made pediatric nursing a specialty, orthopedic nursing a specialty. But then midwifery is a specialty because not all nurses can be midwives. But then a nurse can act as a midwife. A midwife can act as a nurse. because she knows her way around every other thing, room dressing, assisting in the theater, giving medications, health education, being an advocate and all of those things. But then a midwife is a midwife. Like nobody can say that they want to take the place of a midwife. So the practice in Nigeria has been kind of, it's not really very interesting. So
What are the criteria needed to become a midwife in Nigeria?
before you can become a midwife, you have to get into the school and you need your WAEC, either use WAEC or NEPO or combined, but you have to have at least C in biology, maths, just normal biology, maths, chemistry, normal science. Then once you get into the school and you finish your 3 years education and write your nursing council exam, then you'll be able to apply for your license. So after that, you can practice. You are free to practice anywhere in the country.
What is the rewarding part of being a midwife?
The rewarding part of the profession is that you get to feel that you can do a lot of things for people. You know, that even for people that it's not only in pregnancy that midwives are useful.
Yeah.
A midwife is also even before, even children, even let's say adolescents that just started their period, teaching them about ovulation, personal hygiene, then to the fact that you're able to help families start a new life, a new beginning. They're having their children, and you can do the tiniest thing for a woman in labor and she'll be appreciated, just like only rubbing her back. I've worked in where we worked before.
Yeah.
They don't do epidural there.
Yeah.
And
True.
the only ways that I help my patients is that sometimes I run to the pharmacy and collect ice pack and put it on their back to relieve their pain. All those little things that you could do for this woman, giving her all the information that she needs and making sure that every step that she's okay. That fulfillment that you get when you are at home, that yes, I was able to do my job well and the patients are satisfied. That's major reward. Because financially it is not rewarding in Nigeria.
Exactly.
And then the career path in Nigeria, I think you can be stuck in a place for a long time, because there's not a part in Nigeria that can make you continue fully as a midwife. You have to divert into nursing eventually and do something else in nursing for you to keep climbing the ladder.
They don't like make it a specialty, just like they make
just like
pediatric
I want
nursing
like
and all
in
specialty.
civilized countries, in the Western world, you can actually study do your MSc, masters in midwifery, degree in midwifery. You can have your own area of specification that you want to do. In the UK, I've learned that there are lots of other areas that they focus on, like bereavement midwives. These are midwives that help people when they lose their pregnancy, when they lose their baby after birth. Then there are safeguarding midwives, people that they go to, let's say there's issue of domestic violence. These are the people that take up these things, These are aspects that they don't talk about in this country. And according to the roles of a midwife that we were taught back in school, a midwife is an advocate, a midwife is a teacher, a midwife is an educator. All these things, you can't focus on. Let's say I just want to be an advocate in midwifery. I can't have that area alone. That's what I want to be doing in this country. I have to combine everything. I am the one that takes labor. I'm the one that takes care of the woman in pregnancy, takes care of her in labor, takes care of her afterwards, and I'm the one that gives her all that information. So I cannot even focus on one thing. I might have a lot in my mind to tell her at once, but then the work is too much. I can't tell her all the things that she needs to do. But aside that, midwifery is a very rewarding. It's really rewarding because I get home and I'm happy at myself.
Yeah, exactly.
There was a time I was keeping track of all the babies that I have delivered. But at some point, I lost track because I can't even count.
Oh shit.
I can't count. I can't count, but it's such a privilege when patients send me pictures, because I have a lot. Send me pictures like, this is your baby that was delivered last year. I'll be like, wow.
It's actually a good thing that when they are on when they are in labor and you know they are in pain, they actually know they want to give birth. But then it's a good thing that they have a good midwife by their side to reassure them, take care of them. Not like the way they do in general hospital that you see midwife. Though it might be due to stress, but then I feel it's not meant to be why you have to yell at your patient. Oh, do this one, do that one, shout at them, slap them. When I was doing my child and maternal health, you see those midwives who shout, "Oh yeah, open up! This is what they will give the patient a slap." Oh God, they just beat patients and all that. But then I've actually seen her taking care of patient before, and I'm almost like, oh, I wish I'm this lady's patient. Like the way she does treats the patient, she pampered her patient a lot. Like she pampered her patient. You just be like, oh my God, look at the way she. But if you see those that work in the general hospital, those old midwives, the way they treat their patients, you will not wish to give birth. You will not even wish to be pregnant and go to that place. But when it comes to her, you just wish to get pregnant now, so that Nurse Gbadebo will start pampering you.
I just feel like it's personality, because there are midwives that when we were in training back then, that are really nice, even though they work in general hospitals. Like they were lovely. I just feel like it's a personal thing, because I work with some too that are like that. Meanwhile, there are a lot of them as well that's very nice, despite the tension. I can't forget a woman today. We used to call her Mama Becca. She actually had triplets. This woman is beautiful. She always has her makeup on, but she's a midwife and she's really good at her job. Then I remember that once we learned, even our lecturers in school said, go when this person is on duty. That is when
so I can learn well.
And so I don't think it's as now I can mention her name because she's a good person, and I know that there are other people. So I just think it's a personality thing, because it's not like in private hospitals we don't have people like that.
True.
So just personal, it just little things that pop their hands. But I just believe that in everything that we do, we have to like put at the back of our mind that if it is me that is in this person's position,
yes, how would I feel?
Midwifery is a very compassionate specialty. You have to be compassionate, you have to be caring, you have to be empathetic. Like your own kind of empathy is different from the empathy that nurses have. Because
bombastic side eye.
But that's the truth, because midwifery is sensitive.
Yeah, right.
It's very sensitive, because any little thing,
anything lives at the same time,
anything can go wrong.
For
the way you act to your patients can make the patient decide on what they want, although you know that it's their life.
Exactly.
But then if you're not very nice to them, if you're not accommodating, you're not willing to listen to them, if you're not giving them enough information that they need, they might start making bad decisions for themselves, and you don't want this to happen, because whatever is worth doing is worth doing well. It's worth doing well.
So the next question is, how do you handle working under pressure in a stressful environment? Just like Nigeria.
Just like Nigeria. Nigeria is stressful.
Very.
From our daily life. But then I think I'm always grateful that I worked in some places.
Okay.
My first paid employment in Lagos, the hospital, the private sector, but then it's terrible.
From experience, I can actually relate.
We worked there together. It's terrible. So that was where I learned a lot of things. And to be able to work under pressure, I've learned that the organization skills has to be top notch. In doing this, when you get to work, find out that okay, there are things that you know that they are routines. So when I get to work, I first make sure that okay, these routine things, I've done them. So that in case an emergency comes in, I am fully ready.
You won't be caught unaware.
So I make sure that I am always ready. I make sure that I organize my job, the task for the day. I make sure that I list them out. Then I learned that prioritize is the most important thing. If you prioritize your jobs and like from the most important
to the
to the least important, you'll be able to stay calm, because they will say how do you remain calm under pressure. It is if you don't, if you are not able to prioritize what you are going to do, you will not be able to stay calm, because
True.
your mind will be divided into too many things at the same time. So that's one of the things that I do. I make sure that my job is well organized, then I focus on one thing at one time.
Exactly.
I focus on one thing and I call for help. We had our ward managers, they don't want to work, but I make sure that I give them. Somebody says I know how to delegate. If the person is older than me, if the person has more, like the person's cadre is higher than my own, I've learned to delegate no matter what, so that we can have good results.
Exactly.
If I'm turning between places, at the end of the day, I'm unable to get anything done. Like maybe everything will be like half done. Meanwhile, if all hands are on deck, we can finish one thing at one time, and we are sure that okay, we finished one thing, then it's just these ones that are left behind. Then we can face those ones. So I've learned that I prioritize my task. I organize everything as I should. I ask for help when I need it, and then I relax when I am not at home. I relax. I don't go out much, so I'm an indoor body. I'm an indoor person. I make sure I sleep for as much as I want, eat what I want, drink what I want, so that when I'm going to work the next day, I am refreshed. And then there's this thing I used to say, and I still say where I work now. That one's even longer, 24 hours. I say that there's nothing that has a beginning. I'm just getting to work. It's 8 a.m. and I'll be like, before I close my eyes now, it's 8 a.m. tomorrow morning.
I will close.
So, and I will close. I cannot be here forever. As long as I do my job well and I get to, nobody will call me to come back.
Exactly, it's
So
true.
that's how
I've never even
like
had that situation where they call you to come back, and there was
so
one
many
nurse there
people
where we were working before. I don't want to mention. They had to like start calling now. Okay, you did this, you did that. Okay, why didn't you pack your instruments? Why didn't it's really uncalled for. It's not
I've even had
necessary.
to. I wanted to cover up for somebody before, but I could not cover up with the way the person has done herself. I could not cover up because okay, you did these things. The truth is that nursing midwifery is a continuous process, right?
Exactly.
But then
how you hand over properly.
yes,
too.
everything has to be you have to be accountable for everything that you do. Did you document it? Did you mention these things to this person? Did you do this thing the right way you're supposed to do it? That's where it comes in, that you should learn how to do your job well. If there are things that you do not do, say that I did not do these things. So I don't like when I get to people are calling me. People are calling me, maybe it's because I'm the one calling them to ask them, because I used to do it a lot. That patient that I induced in the morning, has she delivered?
Yeah, just to check up on
my patient.
Exactly.
So that's just the thing. I don't like to be called back. So I do my work when I'm at work, and when I'm at home, I'm resting. So because of that, I'm not stressed. I've been in over 4 years, and I still love midwifery. Regardless. I love midwifery.
What is the anniversary?
I love midwifery.
But then I say there's nothing you can tell me that will make me go into midwifery, because I know myself.
Well,
I don't want.
Is there anybody that can render service to humanity?
I'm rendering service to humanity.
How?
So,
I'm
a
not.
nurse, so.
Oh, yeah, you all have. No, you're not a midwife. You're not a midwife.
Imagine. I
am that biased.
I also save lives. So sometimes you save like 2 in 1. And at least sometimes I can be attending to like 4 patients in the ward. I can attend to like 5, 6 patients at a time.
But this patient.
So but you are just like saving a new life and old life.
No, it depends. You are seeing the patient that you're attending to.
Okay.
Yeah, I have 2 patients.
I guess.
Patients that I'm imagining what they look like.
No, let's this.
Patients that just their hands beat that I'm listening
for another day. We're going
to like music to my ears.
Debate. Midwife or nurses, which is better?
I think we should do that.
Panel of judges, call debaters.
I think we should do that.
We need to do that. We need to debate. Bring your point so that nurses to bring
We
their
did,
point.
see, I don't even have to shout because it's empty barriers that make me imagine.
Okay, no problem. It's almost shout.
You don't
It's almost shout. Please just leave it. Let's leave it to
All
that
right,
time.
all
Then
right.
we're going to debate.
All right.
On to the next.
On to the next.